The time ER staff refused to believe a medical emergency. When I was 16, I went to the ER for extreme arm pain. ER doctor accused me of being a drug-seeking teenager. Took over a month to get diagnosed with leukemia. Oop. Went to the ER for X in 1 week due to abdominal pain. The second time in, as I was walking back, a nurse said, "Oh, welcome back," while rolling her eyes. Clearly thought I was drug-seeking, and they were not controlling my pain properly. I told them my colon twisted on itself and died the previous year and needed emergency surgery, and it felt like similar pain. They kept sending me home. The third and fourth times were actually in the same day. It wasn't until I was screaming I was going to die that they were fed up with me and sent me in an ambulance to another place. They checked me at the new hospital and I went in for surgery. My last ovary had, you guessed it, twisted on itself and they couldn't save it in time. Went into surgical menopause before the age of 40 due to that. I'm still not over it. I got called a drug seeker even though no drugs were requested, just begging for pain workup. I finally demanded an MRI because I knew something was terribly wrong, so they did the study to humor me. When I got back to the ED, the neurosurgery team was waiting for me. The spinal compression was so severe I needed surgery. As an ER nurse, these stories make me sad. I truly hope none of my patients have ever felt this way. I make it my daily mission to make sure my patients feel seen and heard. Many ER providers become incredibly jaded with time and lose their sense of compassion due to burnout and bullshit hospital politics. Not making excuses, just know that there are plenty of is that do care. I told them my toddler has strep throat, and I have had it every year of my life and I feel like I have it now. They said, "No, you are just fat and have reflux." I was hospitalized 2 weeks later with sepsis from unchecked strep. Pretty much every woman who presents with heart attack symptoms. I was sent home with a fistful of oxycodone. It was a gallbladder attack. I had a kidney stone and was throwing up from the pain. Couldn't even remember my social security number when they tried to make me sit down to get checked in. I have a long history of kidney stones and knew exactly what it was. They treated me like I was a drug addict. Barely any pain meds. Wouldn't let me pace by my hospital bed. Generally had very rude and dismissive attitudes. Then I got a CT scan. Night and day when they saw that not only was I passing a 5mm stone, but I had 10 more stones between both my kidneys waiting to torture me in the future. I got dosed at a bar and realized it in the cab on my way home. Alone, thankfully. I was just coherent enough to get the cab driver to turn around and take me to the ER. I told him I had only had 2 drinks and I had been drugged and to please help. My last memory is of ER staff hurling my completely unresponsive body out of the cab while the driver told them I was just some wasted college student. I tried to tell them I'd only had 2 drinks all night, but was unable to articulate anything at all. In the morning when they woke me up to kick me out and I asked what I was drugged with so I could file a police report, I was informed that they didn't bother with a tox screen or even a basic test to check my BAC. As drunk as they thought I was, alcohol poisoning death should have been a major concern, but they literally didn't care enough to do the most basic due diligence. Friend went to ER. Worst headache ever. 20 years old. College student, obviously drug-seeking according to them. Sent him home without anything, just an Imitrex. He laid down thinking it would help. Never woke up. Ruptured aneurysm. When I was 5, I broke my arm falling off the monkey bars. The ER nurse took that personally and was so pissed about it. She was taking the X-ray and I was trying to tell her something but she said to be quiet and be still. Okay. Anyway, she X-rayed the wrong arm. My dad was. The ambos left him in the triage area alone, which they're not supposed to do. He was going in and out of consciousness, almost falling off his chair. My mum ended up going in despite being told she wasn't allowed and sat with him. The triage nurse didn't come for hours. His GP who sent him rang to ask how he was going, My mum said he hadn't even been seen. GP called the emergency dept and went off. He finally got seen maybe an hour later. He eventually got admitted, diagnosed with a terminal illness, and died just over a week later. He never left the hospital. The worst part is that the nurses were laughing about him and how his GP called to put up a stink a few weeks later. We know a nurse who works there. She heard them and told them to shut up and that he actually died. She went off at them. My mum wishes she put in a formal complaint at the time, but she was just too overcome with grief to do anything. Thought I was drug-seeking until they ran some tests and realized I had severe pancreatitis. Due to gallstones nobody diagnosed despite months of me begging for help from medical professionals. The doctor sounded shocked when he read my results because he was so sure I was seeking pain meds. Admitted me real quick for emergency surgery to remove the blockage, and I stayed for a week. Of course, this was after me being in the ER for several hours in agony while getting snarky remarks from the doctor. They did not believe me, but when I broke my ankle a few years back, they asked if I was being abused while my husband was in the room with me. That always was wild to me. I broke my ankle because I tripped down some stairs, but man, imagine if it was abuse. I never could have answered safely. I had appendicitis and was sent to the ER by my GP, but they said it was just bad period pains, hadn't even had a period yet, I was 9. When they finally believed me 2 days later, my appendix had burst and I nearly died. It's crazy how often ER staff dismiss patients because they don't fit the typical profile for a condition, like a young person having a heart attack. I wasn't treated badly, but the ER staff, at a standalone ER, not at a hospital, and it wasn't super busy, this was a few years before COVID, was convinced I was either having a miscarriage or a case of food poisoning or stomach virus severe constipation when I showed up with the worst stomach pain of my life. The doctor was even like, "You didn't eat any Chipotle or anything that you can remember?" I came in late afternoon and they took me back right away but didn't order any tests other than a pregnancy test, negative. Until the late evening when I had a CT scan with contrast I actually had appendicitis. Oops. After that it was like, call the ambulance and get this person out of here to the real hospital ASAP. It wasn't bad waiting around because they did give me 4 painkillers since I couldn't even stand up straight due to the pain. I got trapped between a dog and a stray cat and got my finger bitten by the cat hard right on the knuckle. It was Sunday. My husband freaked out that I needed to go to the ER now. Apparently his mom had spent a week in the hospital with cat scratch fever before. My finger was painful and rapidly swelling, although it's a small area so compared to like a big bleeding wound it didn't look like much. Urgent care was closed, so I went to the inner city ER on a Sunday evening for a little tiny pinprick on my finger. The triage nurse laughed at me, the intake nurse laughed at me, the nurse in my room laughed at me. I heard 2 people in the hallway asking if I was the one with the finger ear and laughed. The doctor came in and told me I absolutely did the right thing to come in, that it looked nasty and infected and prescribed me antibiotics and off I went. He said I saved them all days if not weeks of caring for me in the hospital by getting in for antibiotics now.